Thank you for joining us for today's forum, a look inside mental illness in our criminal justice system.
Yep.
I'm Mary Neubauer, co-chair of the Milwaukee Mental Health Task Force and sponsor today's forum along with Milwaukee Turners. I'll review a few logistics to ensure our forum is accessible to all. Captioning is available. Click on the live transcript CC icon to use captioning or turn it off. Then click Show Subtitle. Click View Full Transcript to see the full captioning stream. ASL interpreters are available. If you need communication directly with interpreter, note that in the chat we will reply to you directly. We ask speakers to please say their name each time they speak to help with accessibility. Use the chat feature throughout the briefing. If you need assistance, we will monitor the chat.
Good afternoon, everybody. I'm Christine Apple, also a co-chair of the Milwaukee Mental Health Task Force. People with mental health concerns are vastly overrepresented in our criminal justice system. Even worse, these jails and prisons are considered the de facto treatment facilities for those who have been marginalized and turned away from receiving care in the community. This three-part series, A Look Inside Mental Illness and the Criminal Justice System, will use the Sequential Intercept Model to identify gaps and opportunities to divert people with mental illness and link them to services. We are fortunate to have an outstanding panel of subject matter experts who can talk to us about the Sequential Intercept Model. They will describe the first contacts with the legal system. This program will highlight ways in which change can occur and serve as a call to action to help in improving outcomes for those most in need of our assistance. One quote I just want to mention from yesterday from an attorney: we are deprived of learning about successes sometimes when we talk about these things. So just to recognize that there are successes in our system and ways for all of us to improve, not just one or two agencies, but all of us. So now I'm very thankful to turn it over to our moderator, Emilio DeTore, Executive Director of Milwaukee Turners. Thank you so much, Emilio.
Thank you to my friends. Very excited to be here. We're very excited to be partnering with the Mental Health Task Force and all of our friends in order to share what happens when people undergoing mental health crises come into contact with the criminal legal system. Today's episode is going to be a very important part of understanding what we need to do to help our loved ones, as well as confronting the mass incarceration that can destroy our communities. This is the first of three forums we're going to be hosting on this, and we'll share the information to the next forum later, as well as some other interesting forums we have lined up. I'm also very excited to be joined today by our three panelists. I'm going to tell you who they are and give their biographies briefly, and then we're going to talk about the intercept model briefly. Our first panelist today will be Dwayne Mack. Dwayne is a Wisconsin certified peer specialist and recovery coach for Wisconsin Community Services. Dwayne is a man showing his youth at the age of 55 in how to become allergic to being lazy, recipient of the 2021 Changing the Narrative Award. He's an emergency department recovery coach and certified peer specialist for Wisconsin Community Services. He's a writer, director, producer, actor, dancer, and also the owner of Mack Productions, LLC. Importantly, too, he is very talented and a mentor to many youth that he works with as well at the Olive Garden. We'll also be joined by Lauren Hubbard, Director of Community Crisis Services, Milwaukee County Department of Health and Human Services, Behavioral Health Services Division. As a registered nurse, Lauren has provided psychiatric crisis services to Milwaukee County residents for over 9 years. Throughout her career, she has provided direct care and services to youth and adults in need at Milwaukee County Psychiatric Emergency Room, observation, and inpatient units, along with serving the role of nurse manager of crisis services. Lauren currently serves as the Director of Community Crisis Services, overseeing various mobile crisis teams, crisis lines, and community-based behavioral health services for those in need. Lauren is dedicated to ensuring the most vulnerable residents in our community have equitable access to the care and services they need, and is committed to working with team members, partners, and residents to redesign the delivery of community crisis services provided by Milwaukee County. We're also joined by Assistant Chief Nicole Waldner from the Milwaukee Police Department. Assistant Chief Waldner became a Milwaukee police officer in 1996. Then in 2001, Assistant Chief Waldner was promoted to detective and was assigned to the narcotics division, where she investigated multiple drug investigations. In 2009, she was promoted to lieutenant and worked in homicide division, the internal affairs division, and the police academy. She was eventually promoted to the rank of captain in August 2015 and was the commander of the Milwaukee Police Academy. Assistant Chief Waldner oversees various trainings for more than 1,800 sworn police personnel, along with the department's civilian personnel. She's also responsible for training approximately 200 recruit officers yearly. And in May 2020, she was assigned to the HIDTA. In August 2020, Assistant Chief Waldner was promoted to inspector and was assigned to the Administration Bureau. And in December 2021, she was promoted to Assistant Chief of the Administration Bureau. Very excited that the three of you are able to join us. And for those of you just signing in to this webinar, if you're following us on Zoom, we invite you to ask any questions you may have in the chat so that we can curate them and ask them of our panelists later. And to be assured also that this program is being recorded, we'll edit it and post it on YouTube, as well as the Milwaukee Turners website, and share it with all of you that are with us today. This is simultaneously being broadcast on the Milwaukee Turners Facebook page. I encourage you to share that there, and you can feel free to ask questions there too, as we will curate them and share them with our panelists. So one of the things we want to talk about is we're going to frame this concept by way of the sequential intercept model, which is a model that's commonly used across the country. I'm going to attempt to share my screen quickly so that you can see what the sequential intercept model is, but I also invite you to take a peek in the chat where we will share the link so that you can refer to it if you have need of doing so. So if you just give me one quick second, I'll pop over, and it's there in the chat. I'm being assisted by Chrissy Fung, who's a co-producer of this episode, who's going to be helping to pop these things back and forth. So you'll see a link there, and I'm going to briefly share my screen so that you can see visually the intercept picture. So can you all see the model on the screen now? And so what this is today we're going to be focusing on intercept 0 and intercept 1. Intercept 0 relates to community services, so crisis lines and crisis care continuum. And intercept 1 focuses on phone calls to 911 and contact with local law enforcement, which leads to arrest possibly. And so I've shared that link in the side, and I'm going to now unshare my screen so that we can go back into a brief explanation of what it is that we're going to be discussing. The sequential intercept model shows how individuals, especially with mental health and substance use disorders, come in contact with and move through the criminal justice system. And Milwaukee, in particular, has used this model to help us identify resources and gaps in services at each intercept and develop local strategic action plans. So today, as I mentioned, our panel members will discuss the first two interactions. So the first one, intercept 0. And I know these may be new terms for folks, but it's really important that we learn about these, because if you want to help a loved one who's anywhere through this process, watching today's episode and the subsequent 2 episodes will help us navigate that. The first intercept involves opportunities to divert people into local crisis care services. At this moment, resources are available without requiring people in crisis to call 911, although sometimes 911 and law enforcement are the only resources available, or so it seems. This also connects people with treatment or services instead of arresting or charging them with a crime. In intercept 1, the second part of what we're going to be discussing today, this involves law enforcement. And this could involve diversion performed by law enforcement and other emergency service providers who respond to people with mental or substance abuse disorders, or sometimes both. And this could also allow people to be diverted to treatment instead of being arrested or booked into jail. As I mentioned earlier, and I read the bios, we're fortunate to have subject matter experts from the MPD, as well as the Milwaukee County Behavioral Health Division, and certified peer support specialist, Dwayne Mack, who has lived experience entering into the criminal justice system when he actually needed help from our community. So to kick things off, I am going to turn it over to Dwayne, who for about 8 minutes or so is going to tell us about his lived experience here in Milwaukee many years ago when he was in the midst of a mental health crisis and what happened to him there. And then we're going to go over to our other panelists. So Dwayne, if you could share with us that story.
Sure. First and foremost, I want to thank each and every one that's on this panel, and Emilio, kudos, and even those that are tuning in. Mental illness is the unspoken word that everyone seems to whisper when people want to put labels. I recall back in '87, I remember it so vividly, myself traveling out to, well, actually my mom took me. And as I arrived at Milwaukee Mental Health, the year was 1987. I had on a nice shiny suit. It kind of made you think of the guys on Saturday Night Live. It had that glitter to it. So I can only imagine how I was received when it was time for me to do my intake. And to my surprise, I was not deemed suitable for entrance into Milwaukee Mental Health. So me being who I am, and with my determination to seek treatment, I became boisterous, and my boisterous attitude and tone and behavior landed me with a one-way trip to Milwaukee County Jail. So upon arriving in Milwaukee County Jail, I'm talking 5 East, for those, that is, well, many have never probably seen that as much. But arriving to Milwaukee County Jail and just because I continued to talk, here I am trying to get some help, and I became somewhat more boisterous, and that landed me in the 5 East and to be shackled down for about 3 to 5 hours, and which ultimately land because of disruptive conduct. I think we had one of the, I was taken before the courts and I received time at Wisconsin House of Correction. As I think back to that incident, and it was not very much the best way to get help. Of course, we're talking 1987. Let me bring you up to date. As I just recently spoke with my nephew, who's having challenges, and I mentioned treatment, and I mentioned that it's all right to get a therapist and how huge it is to get yourself some help. It seemed like the word mental illness and therapist is the unspoken word that has a stigma to it. So for a young 15-year-old, I had to be very careful of how I approach him with this. As a recovery coach and a peer specialist, it's easier to target the red flags that are out there, but the underlying issue is always, it seems to be mental illness. But I feel honored to be a part of this conversation. It has been somewhat reflective and therapeutic, even as I look back on my journey to be able to overcome such a label. I think, I love trying to always put a good quote to it. And Glenn Close, the musician, said it best when he says, "What mental health needs is more sunlight, more candor, in more unashamed conversation. You know, as we look, you know, let me be specific for my culture in the Black community. You know, it is the unspoken word. Everyone remembers the uncle that, you know, was in the room and the plate came out and we never seen him. I remember even the label. I remember even my experiences of, I like to say, the wrong, even being incarcerated. The med line was longer than the child line. So now today in 2022, how can we make that look? You know, I think about, that's my story as far as what I've been through, but how attractive can we make this? How attractive can we make the results of therapy and treatment? Boom! You can get some help, man. You can turn out okay, that's self-talk. You can turn it around and you can enjoy life and you can cheer our Bucks on for the second time this year. There's so much to life, guys. I could talk a lot. So on that note, I'll end. Thank you for listening to me.
I appreciate you very much sharing that, Dwayne, and folks in the chat are echoing that, and already questions have begun that we'll take a look at later. As well as to you friends that are watching us on Facebook Live, please feel free to answer questions so that we can curate and share them with our panelists. I'd like to turn it over to Lauren Hubbard, maybe, to talk a little about how the intercept model plays into these first interactions with folks who may be undergoing a mental health crisis at the moment. You know, we heard Dwayne's painful story of what happened to him back in '87. He knew things were wrong. He was trying to go someplace to get some sort of assistance, and it seemed at that time that arrest was the only option for him there. Could you tell us a little about how the intercept model plays into what's going on today in Milwaukee?
Sure. Thank you so much for having me. And Dwayne, thank you again for sharing your story with all of us. Speaking from Milwaukee County's perspective of the services provided, there are currently programs and services in our community where individuals can go for help on their own, or with the assistance or direction with law enforcement if that happens to be a part of the interaction that person is experiencing. I'll start with highlighting our current psychiatric crisis service, which is the mental health emergency room, currently operated off of 9499 West Watertown Plank Road. Otherwise known as PCS, our psych emergency in Milwaukee County is available 24/7 for voluntary walk-ins, individuals who are seeking services, and or for concerned family members to come with their loved ones. The psychiatric emergency also, it serves as a place where if and as individuals come into contact with law enforcement, they can still come voluntarily in order to receive access to crisis assessment, intervention, and then linkage to services, which may include inpatient care or services or linkage to other community-based resources. I'd also share that there are crisis mobile teams and access to 24/7 crisis lines currently in Milwaukee County, both for children, youth, and adults. Our crisis line can be reached currently at 414-257-7222. That number is manned by mental health professionals, therapists, counselors, nurses, and psychologists who work to be able to provide that counseling support over the phone, and can also dispatch non-police crisis mobile teams into the community, wherever a person is, in order to provide, again, crisis counseling, to help stabilize the situation, and most importantly, to help link people to those very valuable community-based resources. That could include stabilization houses that we have in the community, 16-bed residential facilities where people can go to engage in treatment, care, services, and again, get linked to whatever else it is that may be missing. And then on the flip side, for those calls that do come in to law enforcement, our community does use 911 as a resource for things that may not be truly a law enforcement interaction or may have some combination of different things going on. In that case, we have CART teams, crisis assessment response teams, that are built into many of our natural law enforcement responses. Our CART teams are currently collaborations with Milwaukee Police Department, West Dallas Police Department, and newly the Milwaukee Sheriff's Office. So again, for those calls that would already come into 911 or the non-police numbers, we have a mental health resource that is a part of that response for the law enforcement agencies. Those teams, again, have a therapist or a counselor that go along with the officer, and they can help make those assessments, help to stabilize someone who may be in crisis on the scene, and again, link to those resources and follow up to make sure that those connections were made. And that would be the iceberg of the resources that I would share.
Thank you, Lauren. And again, we're receiving a lot of questions on the side, and we'll certainly take a deeper dive into exploring some of those and examining some of the things you're sharing. I'm hoping now to switch over to Assistant Chief Waldner to explain to us what it looks like then when we begin to go to the Intercept 1 component. So the phone call has been made, or maybe something's been observed and a police interaction occurs. What does that look like through the police lens?
Unfortunately, there's no easy answer to that question. Most of the time, we don't know what we're being sent to, right? So a person in crisis can come into dispatch, whether it's the non-emergency number or the emergency number, in many different ways. Family trouble, trouble with subject, disorderly conduct. Families who are familiar with the mental health system, they can call in and specifically say what's happening, which is most helpful. But in reality, because there's a lack of resources and many people aren't tied to a therapist, like Dwayne mentioned, or counseling, and they're not in the mental health system other than police contact, there's not much we're going to know from that phone call until we get there. All our officers have had 40 hours of crisis intervention training. Essentially, it is really helped in the area of Chapter 51 or emergency detentions. You mentioned that I started in '96, and when I was on the job, a call came in for a person in crisis or a suicidal person. I would go there. They would say, I want to kill myself. Something as simple as that. And that's it, nothing else. And that was a drive to PCS, as Lauren had mentioned. We have come light years from that mentality. The CIT training really helped give a greater understanding of what the Chapter 51 is and what it should be used for, and how it's the absolute last intervention that law enforcement takes. We try for voluntary compliance all the time. And I would say more so than not, we get that because people are actually looking for help now. And maybe they can't get it, they feel any other way. But so we have everyone trained in CIT. And if that officer goes to that scene and they recognize that CART is needed, like Lauren had mentioned, then they can request the CART team. We currently have 3 CART teams. We're looking to expand our CART program. But then you're having an officer respond who's had some training with the clinicians at behavioral health with the clinician with them. And so that seems to be, I'm a big fan of the CART model, so anything I say is going to be biased, but I think that's our best interaction with law enforcement, is to have that clinician with us and the knowledge they have access then to caseworkers and follow-up and things like that, that us as law enforcement don't have access to and don't have the knowledge to. We're not, master trained clinicians. So that's what law enforcement has. But Pete, there has to be an understanding that if this act was violent or if someone got hurt, that law enforcement, our first interaction then is to arrest. If someone gets hurt and it's domestic violence comes up a lot with these interactions, that we have to do something, because as law enforcement officers, that is what our duty is to do. But we have had much training since '96, much more training, much better training. And so we recognize that when it hasn't risen to that level, there's a lot more we can do just by talking and de-escalation with these mental health crises when we respond. And we have more resources, but I'm going to put it out there that I don't feel we have enough, and that's nobody's fault. I just think that we need to have more options. law enforcement would love to have more options.
Thank you. And I appreciate the bird's eye view that everybody's given us on this, and we're going to, we have so many questions popping in these multiple formats that I'm going to also, after the event, share the questions with our panelists so that if they want a chance to follow up and answer those or can answer those, in case we don't get to all of them, there may be some opportunity for follow-up. I'd like to dig deeper on some of this. I feel that in addition to the emerging questions, there's a lot of terminology we need to unpack, kind of explore some of these. Folks have very relevant personal concerns that they have surrounding this, as Dwayne indicated, and as our viewers are voicing so strenuously. Mental health, especially when it surrounds our friends and family, is a taboo subject. People don't talk about this. Folks don't know how to gain acceptance and help. And I'm wondering, maybe I'll start a question with Dwayne. What do you think could have gone better based on your interaction that you had back in '87 here in Milwaukee? How do you think, and knowing, taking into Chief Waldner's account that the trainings have improved and things have gone up, what could have been better about your experience, like your process for that experience? And not better, like what could you have done better, but what do you think the people with whom you spoke to and interacted with could have done better to assist you in getting the help you needed, as opposed to strapping you down for 5 hours in a cell?
I think, first of all, I think we shouldn't be too quick to base it off appearance, because I was well dressed. Probably that's why I'm not wearing a tie today. So my point that I'm trying, yeah, I see you, Mr. Emilio. But out of all fairness, it was the chief, she spoke on, the captain spoke on something that was valid. The training, they didn't have training back then. That was 1987. So I think the fact of the matter that they looked at me and they prejudged me, and they're just like, is this, and most of the time, a lot of times, that was the beginning of, that's when things were beginning to turn, to see, like, let me give you an example. When it came to a lot of trips to Milwaukee mental health, and I was taken there I came there voluntarily. A lot of the guys was using that as options as opposed to ending up in the county jail. So I think that's when that whole door was, and that whole angle was looked at. So it was rather, I think it was the education. I think it was the prejudgment. I think it was a few factors. It was a few factors that went against me that day. And but we've come a long way since then. And I applaud even this conversation. This is we're in the right direction. We got a long way to go, but we're definitely headed in the right direction when it comes to this matter. And that's my story right now.
Thank you.
You're welcome.
And I'm gonna open these next parts up. So if unless we start by specifically asking the chief or anybody a question, Lauren, Dwayne, Chief Waldner, you can feel free to jump in. I'm hoping that we can unpack a few things. So can you all explain to us what Chapter 51 is, what CIT is, what CART is? We know broadly, what the acronym stands for, but what is CIT? What is CART supposed to do? What is Chapter 51? And that's open to Lauren or to Assistant Chief Waldner.
I'll take that. Chapter 51 is the emergency detention. It's in the state statutes, and it gives I'll talk about my piece of it, Lauren, if that's okay. So it gives law enforcement the right that when someone won't go voluntarily for mental health services, in that law enforcement officer, either through what they see or what they've been told by whoever's on scene for the call, it gives us the right to take that person pretty much into protective custody for their own well-being or the people around them. That's the non-legal way of saying everything without all the mumbo jumbo language in it. But it is our right as law enforcement officers. So that's how Wisconsin is a little different than other jurisdictions in which the law enforcement officer is called, that we can make that decision based on the facts.
The only other thing I would add to that is for Milwaukee County is also the entity as far as crisis services that is, per the statute, obligated to evaluate those Chapter 51s either as they're being considered or after they have been placed. So when I mentioned before, there are crisis mobile teams. Those clinicians are in the community each and every day evaluating individuals who may have been placed on an involuntary hold throughout the community to assess whether that hold, which may have been needed at the time, is still needed. If it's not, it can be dropped. And again, we work to link that individual to the resources that would be most helpful for them. Whether it is a mental health resource, it could be housing, it could be access to other social determinants of health needs that could very well put someone into a state of mental health or substance use crisis. So we try to not only evaluate the immediate dangerousness that Chief Wallner was discussing, but also what lies outside of that. Whether it's a mobile crisis visit, whether it is a visit to our psychiatric emergency room, which is also currently the receiving facility, where then individuals who may be placed on an involuntary hold, we can exchange that custody and go into the care of psychiatrists, nurses, and other mental health professionals at that time. The only other thing that I will add to that question is, again, CART, what is that? So our co-response team of a law enforcement and a mental health clinician, it gives the ability on site while responding to really have that in-depth clinical evaluation at the time to put them on a hold or not. And also, again, more importantly, like Dwayne said, what sort of resources can we connect them with? So hopefully the next call, or if there is a next call, we can be able to address those needs further upstream.
And who, so I see there's a lot of interactions. Who makes the ultimate call? What happens to a person? Is that the county? Is it the police? Do the loved ones or the family of the individual having the crisis have any say in this? What is that process?
I would say the police make the initial interaction. The loved ones, their input is whatever happened before law enforcement got to the scene, right? So by the time we got there, the threats may have already been spoken and we don't get to witness them or hear them. So that's what the investigation will reveal. What they've said to their family or their friends or oftentimes on social media, what threats were made. Law enforcement makes that decision whether a hold needs to be put on place. But like Lauren referred to, like the crisis mobile team can come out and say, no, that's not necessary, or we can take them to PCS and after their evaluation, they can remove that.
And so taking into other considerations too, like there are a lot of questions now about how do we handle vets and our folks trained to deal with PTSD and crisis of vets? Is there some special layer to that? And then also addressing issues of suicidal ideation. So if somebody is threatening suicide, it seems as though for somebody to be wrestling with suicide, that seems to be criminalized somehow or to be an arrestable offense. And I was wondering, I'm trying to look at this also through the eyes of somebody who cares about somebody and they want to know who to call and they want to know what that's supposed to be like. So what would be the differing process between calling on behalf of a loved one who may be experiencing suicidal ideation? What may be the process for calling in regards to a loved one who's a vet who's suffering from PTSD?
There has been training in our crisis intervention training, the 40-hour training. We do have a specific block of training done by veterans to talk about what it might look like, what we might interact with when we get to that call. But I would not say that suicidal ideation is criminal, but it needs to be addressed, right? And that's where, as a law enforcement officer, it gets a little tricky because we're entering that space in which I don't have the training to decide if this person's actually going to do this or not, right? That's why the CART team, the pair of the law enforcement and the clinician are so important. But as far as what to do or who to call, I'll have to refer to Lauren right on that. That's a lot of mental health within that question.
Well, that's a tricky question to answer too. So I guess the best suggestion, the best thing that I will have to respond to that is each situation is different, right? Every person, what they're going through is different. Every episode of crisis could be different. If there's a situation where someone has suicidal ideation and may have a weapon in the home, or may have been considering overdosing, or may have done so, a mental health professional is valuable, but in that moment, safety is the concern. And currently in our system in Milwaukee County, emergency response and getting that person immediate safety help, medical help must go through the emergency system. So that's 911 or other law enforcement numbers. Where we have CART currently a part of that. And also those respondent entities can always call to our non-police response, right, our crisis line, to have a mental health clinician that is not paired with the law enforcement officer come out and evaluate, whether that is during the crisis or whether that's a strong follow-up after that person has been deemed safe and that the scene has been safe. So if there's a need for safety, if there's a concern for safety, calling police and being able to enact our systems that are built in where we're collaborating is a good response. If it's a lower risk level for safety, then our non-police crisis line is always an option to call, where we can again send out a mobile team and help make a part of that consideration. If our mobile team gets there and then we realize this may be a safety concern, again, we collaborate really well with police as needed to ensure that everybody is safe.
And I think a part of the reason, a complicated topic, and again, I half apologizing to our viewers because there's so many questions. The stream is just moving up and down like this, and that's just one of the streams. I think one of the questions is also after, for example, Barbara asked a question, after a child is hospitalized at Children's after a suicide attempt, they're taken to BHD in handcuffs in a police car after they're medically stabilized, and there seems to be a lack of, and there's no parent involved. And so I understand that these systems are larger, our mental health system nationally has eroded, and so that a lot of this is being thrust upon whatever agencies happen to have budgeting at that time. Is this approved practice? Is this something that's, why is this type of thing done?
I'm not sure which piece you're talking
So
about.
I'm speaking about, say, for example, after a child is hospitalized at Children's after a suicide attempt, they're taken to BHD in handcuffs in a police car after they're medically stabilized. And it seems as though at that moment, the county is out of this picture, and now the police are responsible for transporting a child who's no longer in threat of suicide.
Well, because they're with the police, they're no longer in threat. With the 51, the chapter 51, technically you are in police custody, not for a crime, but you're still in police custody. So I saw briefly something referred to the Children's Hospital. So if, let's say there's an actual attempt, so some sort of harm is done, right? Everyone has to go to the hospital to get cleared. And if it's a child, it's always Children's. There's no, it's not nearest. The other rules that apply to adults don't apply to children. They have to go to Children's. And so that they're taken there to get medical clearance to make sure they're okay, to what the wounds are okay. But the chapter 51, the in custody, unless they're voluntary and we can get them somewhere else, but I don't know that we take children anywhere else, then they are transported to PCS. But no, there is no, and it's still an in custody situation. There's not even for adults a scenario where we allow people to come with us.
I got you. And thank you. Also, another question, which we're getting from a variety of places. There's so much confusion and misconception about undergoing a mental health crisis, about somebody undergoing an experience due to substance abuse and alcohol. How do people know who to call, and what's a good way to express themselves? So there are lots of different numbers, there's lots of different teams. What is there some one single number that somebody can call? Because we also have to remember people are elevated, right? It's emotional. Oh my God, my uncle's freaking out, my sister, my mom, my wife, my husband. You know, people remember 911, but what is the ideal number that a person should call? And is there some language that you can share that would help us, help all of us understand who we should call and how we should explain this so that we get the best possible thing that the person needs?
I can start this one. From Milwaukee County standpoint, especially under the Department of Health and Human Services, we're really working in a direction of creating no wrong door. And I know right now there are some wrong doors. This is a part of a redesign in this important discussion about how we can help make some solutions to those experiences. But I would say for a mental health substance use crisis, 24 hours a day, it's a really good place to start with calling Milwaukee County's crisis line. And our number was dropped in the chat, 414-257-7222. Through that resource, through conversation, through expressing what the need is as the person is experiencing it, our clinicians can help get to a solution about what the next steps could be with that person, involving them in their own services that we can help connect them to. If that conversation means that there's a safety concern, our crisis line clinicians will help contact law enforcement. It's not like hang up and call 911. We will ensure that we complete that call through three-way, given the information that we've assessed and offer to respond as well as the scene has been secured. So I would start there with calling our crisis line if you're not able to physically go out to the mental health complex and to the psych ER, to just start the conversation, and we can help over the phone, either link to services or again, come out to see that person where they are and have those more intimate discussions about what those needs may be, what that might look like. If we need to help get you to an appointment, those are lots of different things that we can help discuss, hopefully before it gets to a level of needing to call police.
That's great. And I just want to add something realistic. I'm old, I have a lot of kids. It's difficult for me to memorize a multi-digit phone number. So say I call 211, because I remember that. Will that, and I also love the phrase no wrong door. I'm going to steal that from many things. But is 211 an opportunity, and who's trained to answer these things? Can the person answering on the other end of this line, do they have the training to be able to know how to navigate that?
211 is a really good resource for our community. They operate a huge database of current community providers and also serve as a gateway to some of those other services like housing. I'll throw out for an example. So there are trained 211 operators that help with all types of resources, and the county partners with them in lots of different ways to ensure we're connecting people to the most up-to-date and valuable resources, even if the county isn't providing them. So I would say, yes, 211 is a good resource. They also forward calls to the crisis line if they feel that there is a need, if they assess a need for further crisis counseling and intervention. I don't want to misspeak for Impact, their own private entity, but I don't believe that their counselors are trained to be crisis counselors. I could be mistaken, but we do have a great relationship with them between 211 and their services and the crisis line as well. And I guess soon, I'm sorry, one more thing that I thought about. As of July of this year, nationally, 988 will become the 3-digit number for suicide and mental health calls. And that will be a direct route for callers to anonymously or throughout the nation to be able to call this line and get linkage to local resources.
That's great news. So starting in July, if I were to call 988, hopefully they would be able to patch me through to Milwaukee County Mental Health. Is there anything, Chief Waldner or Dwayne, that you want to add to Lauren's pretty comprehensive response?
Dwayne, you're on mute.
I think he's.
You got me now?
Yeah.
Old school guy, man, used to being face to face, man. I miss you guys. Lauren, you did an excellent job. You know, 211 is a very good resource for, that's even in one of my divisions here at Wisconsin Community Service. They call 211, they request a recovery coach, and immediately the email comes on my phone. I make the contact. I don't care what I'm doing. I work at I'm fortunate to work at a few places. And I even if I'm not on the clock, I want to call that person and say, you've been heard. So I really believe that, and I can tell by even some of my partners that's receiving these the dispatches, they're compassionate as well and empathetic as well. So, and for us to come to the table, I got my SAC hit as a certified peer specialist and my training as a recovery coach. I'm so prepared to address any of that. And then having the lived experience with the mental illness, I'm able to curtail and direct them in which they want to go. But that's great news, Lauren, to hear about 988. That sounds great. 988 sounds good. That's my take on it.
And Chief, is there anything you'd like to add?
That was the first I heard about 988, and I think we should like start advertising that ahead of time, because I really think oftentimes 911 is called not because people want to, because it's actually like their last resort. Like when you're calling the police for a mental health crisis and something you know is a mental health crisis, if this is family members that have dealt with this, 911 is your last resort when it comes to that. Because I've been working with another group that helps parents identify drug use with children. And I said, and part of the teaching is we teach them how to look for signs of drug abuse, paraphernalia, things like that. But some of the thing is, the lesson is if you call 911, know that there has to be a certain reaction when police are involved if it's violent, right? And so my thing to the public would be call early. That's what I say oftentimes. Call when you first start noticing something, and try to get those other resources that Lauren mentioned. We are always available, right? We're the 24/7 crew, so that we're always available to respond, and we will. CAR currently only works till midnight. So you're coming with officers who will try their best, but this is what I mentioned earlier. We would really like more resources, additional resources, so that from midnight to when mobile crisis is done to when everybody else wakes up in the morning, that we have something to do. We have other options other than 51 at night. So, and it also, right now it feels like it's a city county thing all the time. And I know there's more resources out there that maybe we're just not aware of or that we haven't tapped into. And if so, and people on this meeting are aware of those, I need to know about those, because we're very limited in what we're able to do overnight and weekends. And the county is my go-to.
And thank you all for that. And we've got a lot of questions, because many of the people attending, this is an important discussion. Folks want to learn about this. This is an issue that's affecting all of us, our families, our neighbors, and we want to make the best decisions for the people we care about. A few follow-up questions. Speaking about limited abilities, the staffing only able to work, say the card is only available to midnight. What happens when an individual doesn't have medical insurance? What happens when they need resources beyond, this is still we're still talking about 0 and 1 on the intercept model. So it's their first introduction. What happens? How can a person get the help that they need if medical insurance isn't an option for them?
I will start that one. For the crisis services that are available in the community, and that includes our psych emergency room, mobile crisis services, our walk-in clinics. Milwaukee County will serve residents regardless of their insurance, regardless of their ability to pay. So especially on those nights and weekends, which is where we try really to have these mobile teams or our CART teams available, is when everything else is closed. And so as much as we're able to staff those resources into those hours and those weekends and holidays, that's a challenge for us too, recruiting and hiring individuals to work those shifts, especially at the level that we're looking to be able to provide. But I would say that our emergency room is a resource that's available. People can walk in 24/7, it's always open. And regardless of if you're insured or not, there are options available that the emergency room can help link people to, as well as our walk-in clinics. We currently are co-located with Outreach Community Health Center on Milwaukee's northeast side off of 2nd and Capitol, and co-located with 16th Street Community Health Center off of 16th and National. So those community health centers they already offer mental health services, and there are others that I'm not mentioning right now that exist within the community that can help get people linked to insurance and other things. But our walk-in clinics are also there for that. So if you're in crisis, you need intake, you'd like to speak to a counselor, see a nurse, and get connected to a provider, those clinics are available whether you're insured or not. And a part of that service is then working with that person to get them the best insurance options that are best for them, so that we can again link them to the next stage of their services. You're on mute.
Thank you. And I'm sure, in addition to being an obstacle for the individuals undergoing crisis, that can be a fear for the family, right? So many of us are already not going to doctors, not able to, we're not taking care of ourselves properly. There might be an inclination to not even call and handle things internally because of our inability to afford it, or worrying that there's going to be some big bill at the end of this. And so we wait until the situation has reached a breaking point before we reach out and call 911 or 211 or whatever number we have to remember. Also, speaking about accessibility, language is really important. So, what if I only speak Spanish and I call one of these numbers, or Hmong or Lao or one of the other languages spoken so abundantly over and through Milwaukee? What does that look like? Is that, if I, and this is an open question, and also deaf. So, we wanted to talk about that whole interaction too. So maybe it's a two-part question. It's not only how can an individual who doesn't speak English access assistance, and also maybe if the chief could talk about how the police and also Lauren, how these response services interact with somebody when they come and they're deaf or hard of hearing people.
We have if we don't have someone working at that time that speaks whatever language is necessary, we have contracts with language translators as well as sign, so that we just call them, even if you call 911 and we can't connect you with someone, we have this translation line that we use all the time. And then it can also be accessed on the street. Typically, we do have someone working that speaks a certain language, and we do have also people fluent in ASL, so we have that as well. But we do have these contracts with other language services.
Yeah, I echo that as well.
Great. And does WCS, Dwayne, not to put you on the spot, do they also offer services for folks who are non-English speakers?
We do have bilingual employees with WCS, and And I'm always one that always thinks outside the box. If I know that you speak Spanish and I got this person, I got a couple phones, so I just make it happen. So I don't want to lose people. I think basically what we're talking about is no matter what, it's time to really listen up. It's time to really, kind of merge and connect and make this happen. So I'm telling you, I'm really, just sitting here patiently and quietly and just impressed that here we are and we're getting questions and we're having this conversation, which is so huge. So whether you speak Spanish, Hmong, whatever, we can help, we want to help. That's, and I get that from all of the panelists that's with me. And it's cool in the game, but yes, to answer your short answer to your question, Emilio, is yes.
Thank you. Another question too, since we're talking about, the first interactions with folks who may be undergoing a crisis, what about, what options are there for individuals who are uncertain? So I'm a child, I'm a partner, I'm a neighbor, and I suspect that my neighbor needs assistance. Frequently, if a person has a long-term untreated circumstances going on, there may be indicators. What resources are there before it's gotten to the level of emergency? Is there some way that a compassionate individual who cares about somebody sees something going on, and who would they call? And what does that look like?
I don't want to keep beating the number with a stick, but I would just offer again, just call us, call our crisis line. These are conversations that our mental health professionals have with concerned residents, neighbors, other customers at the George Webb, where somebody just may have something going on and they're not sure how to help. We come out to see people. We've done this several times, our mobile team, if the person is willing, to try to help engage an individual who may be having something going on. And we would love, love, love to be called further upstream. So again, we can help reach out to that person and engage them before they go into a significant crisis.
Thank you. And kind of a tag into that, again, with people's over-reliance on calling 911 to solve everything, right? Like my neighbor stepped on my lawn earlier today and I need you to take a handle on this. Does the police also refer back to the county and other people to divert and recommend the hotline?
We've only once we get there. Once you make the call, we have an obligation to respond, right? Because like I mentioned earlier, you don't know what you really have till you get there. But we've sat down with people. When I was an officer so a long time ago, when I've sat down with people and called because the crisis line's been forever. I don't know when it was created, but it's been there forever. But I've sat with people in their homes because they want to talk to somebody, and that somebody wasn't me. So we would call the crisis line together.
That's good to hear. Another question people have is in regards to CART and CIT. Questions about training. Are these new programs for Milwaukee? Is this something that's expanding? And what does it look like for, what does the CART training look like so that people know that they're interfacing with a qualified person who's able to assist them through this episode?
We had the CART team, or I'm sorry, I'm going to start with CIT because they're two different things. Crisis intervention training, it used to be prior to like 2014, I want to say. I'm not sure on the date, but it's around that time. We had it where specific officers who had an interest in learning more about mental health and the process and how to respond to these calls for service that involve people in crisis. So they used to write a memo and say, hey, I'm interested in this training. I want to be part of this team. But then Mayor Barrett had made it where he said, no, everyone has to get training and it has to be 40 hours. So then from that point on, everybody, I 2015, I want to say. So we had crisis intervention training for a long time, but in 2015, 2014, we made it mandatory for every single officer, detective, anyone responding to calls for service had to have the 40-hour training. It just, we had Dr. Dykstra, who deals with, I don't know if he still works for the county, but he used to, and he works with juvenile behavioral health, and Dr. Thrasher, and then the Veterans Affairs, so many different speakers coming to train. The CART model, I got to the academy in 2015, and I believe we only had like 1.5 teams at that time. And so we've expanded over time to 3. We did 1 team, I think, through a grant, and it was all about a wellness grant. It incorporated us responding to calls regarding mental health, and then also about wellness for officers, how to ensure our own mental health. So that we got another CART team from that grant. And the training, there's a little piece for law enforcement, how the clinician and the officer should interact, because they don't know how to use our radios. They don't know what our codes mean when we talk over the radio. So they have to be kind of brought up to speed on how to communicate with other law enforcement officers while they're on the street with their partner. But most of the training is done by the county. So I'll let Lauren handle that part of the CART training.
Thanks, Nicole. And the CART officers for all of our programs, including MPD, are selected officers. So they're dedicated officers that are part of these units. And once those officers are selected, they spend roughly 3 weeks with our non-police mobile crisis teams, really getting immersed in the social service aspect of it. So if this were, even though this is a co-responder team, we really immerse them in how our non-police response might respond. We also ensure that our CART officers have a wealth of knowledge about the county's resources. So they're armed with knowing where our clinics are. If they walk onto a scene and maybe this person could use an outpatient therapist today, and this would be something to help them. Our stabilization houses or community resource centers. I'm listing some other residential-based options. So we really ensure that our dedicated CART officers know about these other mental health resources to give them those tools in their belt so that they have other things to choose. So that's an additional part of that training. And whatever other trainings, motivational interviewing, assist training, which is a suicide intervention training that we're starting up to offer to our officers at this time. So the CART team is a part of our mobile crisis response, but it truly is a resource for the law enforcement system. I'm sorry.
There's like 90 other topics we have to cover in 20 minutes. But you touched upon a couple of them, both of you, and I'm not sure which of the two to dig into first. So we'll just start with additional opportunities, say, that are available to the county and the police that maybe aren't, say, law enforcement. Are there other groups that you connect with? For example, if I'm AODA and I'm having an episode due to my addictions to whatever chemical it is I'm addicted to, are there other services that are available that that the county or WCS or the police refer to so that individuals get help? And then once we take a look at this, I'm going to shift the whole conversation into housing. So what other resources are? I mean, so for example, Chief Waldner talked about some of the education they give to see if, a person you care about may be abusing substances. You talked about some of these other interactions. I think that Milwaukee is rather different from some of the other cities I have experience with, New York City, Philadelphia, Miami, where there seem to be many more drug treatment facilities, whether they're short-term or long-term. And that's something that's more acutely integrated. Now that, we're talking about, we have an increasing homeless population, substance abuse, such as the prevalence of fentanyl has such fatal reactions to anyone exposed to it. And that doesn't mean that any of the other drugs have disappeared. It just means that there's another increase in the palette. What alternatives are there for individuals who are concerned over their loved ones' AODA issues.
I think I'll address that one, give these ladies a break for a minute. The most important thing when you see something, say something. You know, I think if I can overshare a little bit, I'm experiencing that with my 15-year-old nephew. And it was just, I got the call that he has not been big on his attendance, but when he came upon me, I smelled marijuana. So I know that's been the big thing with the youth right now is smoking weed. So I went in, I said, man, you smell like some, woo-wee. What's going on with that? You know, just trying to make him feel comfortable enough. And he told me that his friends are doing it. So then I was able to observe a pair of $162 pants that I bought him for Christmas, because I should note he is a very good kid. He's got a great heart. But there was a lighter that fell out of his pocket. That concerned me. So the fact of the matter that you have a lighter, do I have to pee test you, little man? You know, that's just from my angle to my family. You know, I come with a different approach as a recovery coach. I don't play when it comes to letting them stray. So to address your question, when you see something, say something. They can just call 211. As a matter of fact, I've had many parents over the past 2 years who have they call on behalf of their son. But as long as they bring their son with them to our offices on 27th and North, that is one of our locations there. As long as they bring their son with them, we can have that sit down and sign papers and just have a conversation. As a matter of fact, on Saturday, I was at a 19-year-old house who started when he was 15. And even the question even came up. I said, would you be interested in therapy? I even asked my 15-year-old that. And their face got that frown. Like that's that, it seemed like that's that bad word, mental health. But I applaud the parents that when they see it, they're saying it and that they're doing something. So with that 211 call, you can begin the conversation. And we have many people, it's like 7 of us in my division as recovery coaches, and we're gonna contact you ASAP. So I think that that's important, that to begin the process and to follow up. We can't just keep dropping the ball and letting these kids go by the wayside. That's all I got.
Thank you. Yeah, I appreciate the concept of the early intervention. Chief or Lauren, do you have anything else you want to add? I mean, sometimes there's this whole added wrinkle, right? Like my kid, my husband's doing drugs, but I don't know who to turn to, but I'm afraid to call the cops because then they're going to get arrested and I don't know what to do. In addition to AA and NA, which I think people should call, and especially if they don't understand what to do, they can get some advice. What are, and that's Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, there's lots of anonymous out there. Where can people turn? And I see in the chat, people are also recommending NAMI to call for that, and I underscore that.
Yeah, I echo that. And just to piggyback off of Dwayne's comment. So my perspective from behavioral health services is primarily crisis. And any of the resources that I've mentioned already, that's a starting point. It's a starting conversation. And a part of the things that we might link you to would be recovery services or other long-term case management or other ancillary services. So yes, whether you call the crisis line or have a mobile visit or go to a clinic, there are also resources on our website for our community access to recovery division. We call it CARS for short. But CARS encompasses not only mental health resources, but also recovery focused resources. And it's a whole network. You can go to one of our 3 or 4 access points, which WCS is one of those, where you can walk into those listed addresses, have an assessment, and figure out what the best, package for your needs may be, depending on where each person is in their journey. That's through the adult services. And then Wraparound Milwaukee is also a part of behavioral health services. So that's a whole different network of contracted providers and resources that through a call and a brief screening, we can help figure out what the best fit is for individuals, including a detox center. That can be another access point to starting other residential case management, whatever those needs may be.
And from the law enforcement perspective, if you're going to call us about a drug problem and or drugs present in the house, we're left no choice. You know, we have had families call or parents call or saying, and they found drugs, we will take it, we will confiscate it, we will get rid of it for you. But when it comes to the law enforcement perspective, we don't have the resources. Like Lauren said, we deal in crisis. We deal with like 414 for life and OVP, Office of Violence Prevention. I'm sorry, I'm still using acronyms. I shouldn't do that. We use all these other resources, but they're mostly, you know, for crime, and people were trying to defer from violent crime, not as much as focused on the drug and alcohol type diversions. But I noticed in the chat, like, I mean, there was one resource after another. So they're definitely out there, but by the time you call police or something you think is a problem, if there's evidence of that there, then we're kind of stuck.
Thank you, and thank all three of you for framing that in these different contexts. You know, this is obviously a very important topic to folks, and we will eventually have other forums just focusing on drugs and addiction, and what some of those solutions for approaching that with your family and community members are. And also, when we edit this video, we'll make sure that we put the different names and resources there, since it is a treasure trove of resources, and you shouldn't be responsible for just cutting, pasting chat in a casual thing, because it's your family and the people you care about's lives on the line. I want to just pivot over to housing. I think that a lot of folks who are suffering from crisis, there is a big overlap with housing too, and people tend to self-medicate when they have a mental health concern going on. You know, we have a horrible insurance system in this country, and so people don't know where to turn for that, and so they do know that they can anesthetize previous traumas with booze and drugs, and at least it seems to be a temporary fix. And frequently homelessness and a lack of stable housing come very quickly behind that. Is that part of the solution for a recipe or an ingredient in the recipe, Dwayne, Chief Waldner, or Lauren?
Well, I definitely can relate to that. The fact of the matter that a lot of my clients, they're faced with homelessness, and it's, of course, it is from a lot of the lifestyle that they're living. Example, one of the men, I was parking my car in front of my office right there on 27th and North, and as I was bagging in, it was one of our cold days, like 10 days ago. It was like about 5 degrees. And I noticed that the coat that the young man was wearing, it was a blanket. So that really made me just kind of reach out, and I seen the youth in his face, and I said, "Excuse me, young man, I'm not trying, my name's Dwayne, Mack, ED2 recovery coach. This is Wisconsin Community Service. And what we do here is we offer resources, man. I don't know what you're struggling with. You want to have a conversation?" He's like, "How did you know?" Well, I kind of read your body language. So to find out that a lot of times that in his particular, you know, due to certain laws, I'm not going to be specific, but a lot of times, a lot of these guys, they have actually chose to, you know, the youth, they have chose to run away from something that they're ashamed of, or something that's occurring in the home. And to have that kind of, to have the freedom, you know, I can relate even at the age of 9, how I like to not be at home. And we lived in Hillside, and I didn't like our conditions. And I've always wanted to do something with my life, and I thought, be riding a bus and going downtown was better than just being at home sleeping on the mattress. So I think that was my early beginning with trying to escape. So I think that even now, what these young people are dealing with, when you got the perks and you got the white and you got the green and you got the liquor and you got just the death dope. There's just so many different temptations for these people, and yes, and not to have a room, not to have a blanket, not to have a mattress, not to have a secure home. It makes you roam. It makes you become animalistic on its own. Yeah, I can relate to that. So I think you're on the money when you bring up that kind of topic. That's all.
Yeah, thank you for that, Dwayne. And I wholeheartedly agree. It's really challenging for a person to be well, and whatever wellness means for them, when they don't have stable housing. And that is a challenge across our nation, and especially here in Milwaukee. We do our best to partner. We do partner with the Department of Health and Human Services, Housing Services, formerly the Housing Division. They operate a street outreach team that is in the community all hours of day and night, working to engage individuals that are living on the street and to help connect them to housing resources. And again, as a part of what we do our best to do for individuals as we're serving them in any other capacity, part of linkage to resources includes any of those basic human needs that helps a person achieve total wellness.
I know that our CART team and our community liaison officers at the districts, they work with the county and with housing and try to get them resources. But being homeless is not a crime. And a lot of people, it is hard to convince someone to go into housing when they don't want to. And I know that a lot of our officers work with the county and the representatives and CART team if necessary to find them housing, but it is really hard to convince someone to go somewhere they don't want to go.
I appreciate all your answers on these important questions and on these topics, my friends. We don't have much more time, and I think that really any of these topics, which we've only so lightly touched upon, especially as it pertains to just the first third of what this intercept model looks like, takes us so deep. It's easy for us to forget that we're looking at an intercept model, which is discussing the different nuanced ways that an individual at frequently the most extreme emotionally and tumultuous part of their life will interact with strangers and other folks when they most need help, whether it's the individual suffering from the mental crisis at the time or the reaction to whatever AODA thing is going on, or it's the interaction that all of you may play in connecting with the lives of these other folks. So before I turn it over to Barbara Beckert, I just want to thank you all for your participation. Also, the people viewing this and the people sharing in the sidebar, thank you very much. I've shared too. I want to invite you not only to come for the next one, which you're going to hear about later on, but also we have a Zero Youth Corrections Forum coming up on February 10th and February 17th. And we invite you to help us find solutions to preventing young people from being impacted by the criminal legal system. And I didn't really get a chance, sadly, to talk about something a little aspirational, maybe some of the big changes in the system that's going to occur with the Milwaukee Mental Health Complex and PCS closing. I'm not even sure what that's going to look like. So maybe before we part, I'm sorry, I mismanaged your emotions behind this, Barbara. Maybe if you can speak to what some of those big changes are going to look like with this real quickly, and then we'll shift over to Barbara. So I don't know if Lauren or Chief Waldner want to talk about what the health complex and PCS closing is going to mean to all of us, or the systems that you already mentioned.
Yeah, I'll do my best at that one.
Thank
So for some time now, Milwaukee County and our partners have been looking at redesigning our continuum of crisis care. That doesn't only include the county, that absolutely includes all of our partners and other resources. So as Milwaukee County's mental health complex is on a path to change, and the county is moving towards being more upstream and community-based, there are a few things that are happening. Our inpatient hospital will be closing and transitioning to Granite Hills Hospital that is open now, and working on transitioning that inpatient care. Our mental health emergency room, which is also currently located at the mental health complex, will be transitioning later this year to a partnership that will include the 4 large health systems that also operate emergency rooms within our community. That partnership will bring all of our systems together in a way that we can, for one, move closer to the community. So the new location is under construction at 12th and Walnut. It is much closer to all of the community members that we serve currently out in Wauwatosa. So to be closer to services, hopefully that will allow individuals to walk in to seek voluntary services, to have a different environment than in our emergency room currently. And it will allow us to increase our access to other resources, again, not just being the county as the primary provider of the services. So Ascension, Children's, Freightert, and Advocate Aurora are our partners in this new mental health emergency room that will be moving much closer to the community. We're very happy for that.
Well, thank you. Again, incredible wealth of information. Mr. Mack, Ms. Hubbard, Chief Waldner, it was a privilege to have you share your time and multiple viewpoints on this. I mean, there's just so much information. I really feel like people are drinking from a fire hydrant here, but it's incredibly important. I'm just going to give 2 quick plugs again before I turn it over to Barbara. Session 2 on this topic, we'll be talking about other elements in the intercept schematic, is going to be Thursday, February 24th from 12 to 1:30. And the link for that is bit.ly/mentalhealthmke. And that's shared in the chat, and we'll share it on Facebook. And then again, if you want to participate in the February 10th or February 17th Zero Youth Corrections Forums, the link for that is bit.ly//Z_Y_C forum. And I want to thank you again. And it's my pleasure now to introduce Barbara Becker.
Thank you, Emilio, and thanks to our amazing panel today. So grateful to have the opportunity to hear from you. So I hope people don't leave yet because our work is not done. We've heard today about a lot of the needs in the community and that we need more resources, mental health resources, and also policy changes that will connect people with services and divert them from the criminal justice system. So the only way we can change that is by voting, by being informed voters, and also ensuring that more people with mental illness who have criminal convictions and might not be sure of their voting rights, that they understand their voting rights and they have the opportunity to cast a ballot. So this is a big election year. We've got an election in Milwaukee on February 15th, another one on April 5th, and I'm telling you, local elections matter. County supervisors, the new mayor, circuit court judges, they all make big decisions that impact the lives of people with mental illness in our service delivery system and of people in the justice system. So let's turn out. And in the fall, we have our state legislative offices on the ballot, as well as all of the congressional House seats, as well as US Senator. So very important election. So I'm going to share some resources with you. I encourage everyone to check out My Vote Wisconsin. You can see if you're registered to vote. If your information isn't current, you need to update it, see what's on the ballot for you. And you also have the opportunity to request an absentee ballot, which can make it easier to vote. So that's a really good option. You also can see where early voting is taking place. And in the city of Milwaukee, they do a really good job with early voting. And here is their website for the City of Milwaukee Election Commission to check out. If you don't have a photo ID, that's often a barrier. A lot of people with disabilities and mental illness may have a limited income. They don't drive, they don't have a driver's license, so they need that state ID for voting. So here are some resources that can help you with that. This one, bringit.gov, tells you everything you need to know about photo ID. And if you have questions about any of these things, Disability Rights Wisconsin, my agency, has a voter hotline. We would love to help you. Please give us a call. We also have a lot of great resource materials, so we can give you materials to share with your friends, family, clients, and get the word out so people turn out and vote. Finally, we recently did a collaboration with the Department of Corrections to provide training for staff on restoration of voting rights for people who have lost their voting rights because of a felony. And a lot of those people live in Milwaukee and they may be afraid to vote and not sure what their voting rights are. So I'm going to share the toolkit with you. We put this together along with the League of Women Voters, and there are a lot of good resources there. Again, we're available to do trainings, speak to groups, give us a call, and we can help you with the information you need to support folks in your care with voting. We also have our spring election toolkit, which has all kinds of information about voter registration, absentee voting as well. So we hope you'll check out those resources, and we hope that we will have a historically high turnout in Milwaukee for the upcoming elections, as we did during the height of the pandemic in 2020. Let's ensure that we rev up the Milwaukee vote in these important elections. So happy to hear from any of you if you have questions. And at this point, I'm going to turn it over to our co-chairs, to Christine Apple and Mary Neubauer, to give some closing remarks. And we hope to see you again at the next forum.
I don't see any questions in the chat right now. So again, thank you to our panelists, Nicole Waldner, Dwayne Mack, and Lauren Hubbard. And thank you so much, Emilio DeTore, for your wonderful job as moderator for today's presentation. It was just, you know how to handle several different chats and questions and flows of information coming at you. It's a talent. Thank you for everyone who's joining us today. We encourage you to join us on Tuesday, February 24th at noon. Note the time, noon, for the second session in a series of Zoom forums on the way that people with mental illness encounter the court system. This session will address what happens if someone with chronic mental illness is booked into jail and faces criminal charges. If charged, what happens if competency is an issue? Those topics will be addressed in the second part of the Sequential Intercept Model. And register at the link that Barbara's providing in the chat. Okay. Mary?
Yes, Christine, thank you. I would like to thank Sue Gadich, one of the members of our steering committee. I received a recent email from her stating that the legislation went through for decriminalizing fentanyl test strips, and the governor is ready to sign it to go into law so that we may lose fewer lives to the fentanyl epidemic that we have going on in Milwaukee and the state of Wisconsin, and that our efforts were a worthy cause supported by the Mental Health Task Force. So that is very good news today. So thank you, everybody that participated in the Karen Avery Forum, where we decided to get support from our Milwaukee County Mental Health Board, which I am the representative on, and we took it to the county executive and up to the governor. So thank you very much, and we look forward to seeing you on the 24th.
We'll see you later. Thank you for attending. Take care of one another. Bye-bye.